Hey, it's so wonderful that it's being recorded. Welcome to the Aquifer Educator to Educator webinar series. Today, we're going to be talking about how to engage your faculty and students with Aquifer in your educational program. So I'm Dr. Sherilyn Smith. I'm the Chief Academic Officer for Aquifer. I'm also a professor of pediatrics, a pediatric infectious disease doctor at the University of Washington School of Medicine. And I'm the clinical skills learning specialist, helping students at the University of Washington. So it's my pleasure to be here today, and thank you all for making the time. So today's learning goals are to understand what we know about Aquifer integration into educational programs. We have both the student as well as the faculty perspective that we will be sharing with you today. We're going to learn a little bit about tools for orienting faculty and students to Aquifer, and then you're going to get some great practical tips from other educators from around the country, as well as a wonderful student, about how to orient students and faculty to Aquifer. So I think it's going to be a really great session that we have. So we looked at the comments and the questions that you all had for our webinar today. And we just want to make sure that you all know that this is one of a series of webinars that we've put on throughout the summer. Here's a listing of some of the topics. So if your specific question is not answered today, please know that we are here for you. You may get your answer on some of the previous webinars. They're on our website. So you know, we have 2 more coming up. Again, one in a couple of weeks, focusing on WISE, which is a surgical educational course, as well as WISE on Call. That is a residency prep course that were put together by our NYU colleagues. And then our final offering in this summer is about remediation, which will be happening in August. So for today, our agenda, we are working through our introductions, which is one of my favorite things to do. And then I'm going to spend about 10 minutes talking about Aquifer integration and some of the integration tools that we've created to help you make the most of Aquifer in your educational program. Then we're going to have a great panel discussion. The first part of it is orienting and educating students with Aquifer. And then the second part is the panel discussion about orienting and engaging faculty with Aquifer. We'll come at the very end, we'll sort of wrap up, summarize, and then send you on your way. So again, really great that you're here today. So a couple of logistics notes. Please disable your video. You all are automatically muted right now. And we do care about your questions. So please put your questions in the chat. We're continuously monitoring that, and we will be answering them real time. The panelists, if they're not actually presenting, will be able to answer your questions in the chat, so don't be shy. This session, as you know, is being recorded, and we will be sharing that via email and on our website. So you can look for that. And if you miss something the first time through, you can be just like our students and watch us double time if you need to. So here's a brief introduction to our great panelists today, and they're going to do some more in-depth introductions when we introduce them and they begin to share their pearls. But I'm so pleased to be joined by Dr. Sood, who's an internal medicine doctor at the Ellison Floyd College of Medicine at Washington State University, as well as Dr. Bierman, who is our co-student engagement lead at Aquifer, also from the Department of Internal Medicine, and is at Northwestern. Dr. Bauman is a clerkship director, family medicine physician, and directs the longitudinal integrated clerkship, again, at Washington State University School of Medicine. Dr. Drawis is a family physician as well. She's the Dean of Faculty Affairs and Associate Chair of the Integrated Medical Science Department at Florida Atlantic University Schmidt College of Medicine. And finally, Ms. Nabi, soon to be Dr. Nabi, is our 4th year medical student at Case Western Reserve School of Medicine. So these are the people that are going to give you the great practical tips today, and they'll do a little bit more introducing later. So a little bit about Aquifer, if you don't know us. We are an educational not-for-profit, and we are dedicated to delivering the best healthcare education through collaborative development and research into innovative, high-impact virtual teaching and learning methods. And we've been doing this for 20 years, and this has been our mission the whole time. So we are very grateful that you're here, and we don't do this alone. Part of who we are is our educator consortium. So there are more than 65 medical educators who work with us on our course boards and interdisciplinary team: internal medicine, pediatrics, family medicine, geriatrics, basic scientists, radiology, MD, DO, PA, NP educators all working together. And that's our consortium, and they work in collaboration with more than 250 other educators throughout the country to continuously update our cases, the content and assessment tools and educational tools that we'll be sharing with you. So we couldn't do it without them. And we do this in collaboration with a number of educational organizations that are listed here. And what we do in Aquifer is translate the national curriculum from all of these educational groups into virtual patient cases. So make the curriculum come alive. And so you can be rest assured that the curriculum is deep, it's peer reviewed, it reflects what national educators think is important for our students to learn. We partner with these national organizations, and as part of our not-for-profit, we give back annually in grants to support innovative scholarship that these organizations are putting forward. So I want to share with you a little bit about what we know about Aquifer integration. We've looked at both the teacher as well as the student perspectives, and as you might suspect, not everything completely aligns. So I think it's an opportunity to learn a little bit and to think about how this applies to you. So we have a student advisory group, and we ask them some questions about using Aquifer and how to think about using Aquifer in May. So right in the middle of all of the disruption that happened due to the coronavirus. And they felt like Aquifer was a key resource at that time for preparing them to go back to clinic. And you can see here some of the contents that it's a great way to learn clinical content, especially if you can't physically be in clinic. And I just want you to hold that idea, because I think that we're learning a lot about how to best educate our students during this time of the pandemic, that probably some of this is going to stick and go forward. The students really feel that it's valuable, it's realistic, and it helps them think in a safe learning space. They also told us that the most effective learning occurs when cases are connected to the curriculum. And so sending students off and saying, just do some Aquifer cases is not the best way to get them to use them and for them to learn. So if you can link them to an exam, a classroom activity, a discussion, that's the best. If you don't do it, it feels like extra busy work. And so for those of you who've used Aquifer, you might think about whether or not you've heard that comment, and hold that sort of intention with, they feel like it's valuable, but it's got to be integrated. Students really do enjoy the discussions and understanding how Aquifer helps support their learning and becoming a physician. Some other practical tips is assign the cases, and assign cases earlier. So if you assign cases early in the clinical rotations, it really sets them up for success. So I'll give you an example of when I was a pediatric clerkship director, is I assigned the cases having to do with well child exams from the first day of the outpatient rotation. So the students were prepared to go in and do those kinds of clinic visits where they've never done them before. Students also note that the format and real world experience is very valuable prep going into the clinics and really exciting for early learners. So thinking about how you can structure that and give access to your preclinical or didactic students when they're with these cases. And they really said that some of the detail and communication modeling that third-year students, particularly late third-year students, find a little frustrating is super valuable for these early clinical students. The other, so while they said assign the cases, make sure that you don't overwhelm the students. So assign fewer cases to avoid fatigue and improve focus. So each one of the cases takes somewhere between 30 and 45 minutes to complete. So think about that when you're doing your assignments. And an assignment actually is a good idea. Space the assignments and due dates throughout the course. So help scaffold the students in their learning. I told students don't wait to the very end of the clerkship to do all the cases because they would be really sad. It takes too long and it doesn't allow them time to study. So that was the student voice. What do educators tell us? So we did an integration survey in January, so before COVID, to all of our users, and you can see there's about 268 responses. And in contrast to what the students were telling us, most people assigned Aquifer cases as homework, some as an optional resource. And then as you go down the y-axis there, you can begin to see that a significant portion, but less than the homework crew, use these as interactive sessions, as remediation, as materials for lecture, and in clinical presentations. So we have a little bit of a disconnect, but that was pre-COVID. So let me show you a little bit about what happened and what we've learned during this pandemic. So we surveyed, so as part of our grant program, we asked people to fill out a very short survey to tell us what they think is going to happen during COVID and what they have done during this pandemic. And so here are the data, and you can see is everybody expanded the use of Aquifer in existing courses. A significant number created new clinical courses or electives and established courses that didn't even exist before. And about half of people started using Aquifer to support that preclinical and didactic learning, just like the students were asking us to. Only 4 of the almost 200 people who responded said they didn't change. So we were learning things together as an educational community. And I want you to remember that when you're thinking about how you use Aquifer in your courses and how you orient your students and your faculty to its use. So we also ask what challenges people anticipate they're going to face. And you can see from this slide that it really has to do with reduction of clinical sites, insufficient training sites, worried about students overlapping, and reduced faculty travel to national meetings and workshops. So we need to continue to work together as an educational community to maintain that enthusiasm for education that I see. You're also seeing that there continues to be significant worry about student safety and having enough PPE for them as they go forward. So what I'd like to do now in the next few minutes is to talk about some of the tools and that are available to you. So the first recommendation is take the orientation course, and I'm going to show you exactly what that looks like and where it is, and have your key staff do the same. We've broken it down into 2 different types of courses. It's easy to do, and I think that you will enjoy taking it. It gives you a feel of what the courses are like for the students. Oh, here we go. Recommendation number 2 is have the course directors review the educator guides. I'm going to show you where the educator guides live, but this gives you a picture of what they are. They're available in Aqueduct. We have them for every course, and they're ready to use, and they also have ready to use educator resources. We know how hard it is for you to create new curriculum with all of these materials, and so we've started it for you, and they're there for you to use with your Aquifer cases and to adjust as you need to meet your curricular needs. We have lots of resources for faculty. There are integration tips on our website. We have a teaching blog and pearls these webinar recordings and some user videos that are short 1 to 2 minute videos that talk about how other educators use the Aquifer in their courses. We also have getting started tools. So if there's some technical things you're not exactly sure how to use, or your instructors are wondering about that, it's all on our website. And then there are people behind the website too. We do one-on-one peer consults with educators, and our great support staff at Aquifer is there to answer any questions that you have. Recommendation number 3 is link the student page, which I'm going to show you, in your student orientation materials. It's one web page. It has student story videos. It links to the student advisory group, and we are going to be recruiting new members shortly. And it outlines specific tools, what specific tools there are for students. So we have learning resources in Aqueduct, and I'll show those to you. At the end of each case, there's a case summary and really highlight that for students. That's how they can study. And these are mobile, so they don't have to be linked to their computer the whole time. So what I'm going to do is get out of this computer, get out this slideshow and show you where all of this is. So here is the website, our Aquifer website, and there's 2 places that I'm going to show you right now. The first are the teacher resources. So you link on this this drop down. You see Educator-to-Educator resources and the how-tos. So I think that that's a great way to think about it. You click here, and you're going to see that we have lots of different things. So the things that I mentioned, the webinar series, the Teaching Pearls blogs, educator resources, and how to get a peer consultation. So it's all right there for you and your faculty. For your students, go up to the top of the page, and then you'll link right to the student page. And so here we have this one page right here. You can walk through it in your orientation if you'd like. It explains why Aquifer cases are helpful, some student videos, and then how they can use these for learning. Great. So with that, what I'm going to be doing, so let me go back to my slides, is we're going to start talking. I'm going to stop talking in a minute, but we're going to start talking about how to orient and engage your students. So Rose, if you can give the first poll, that would be great. So here's the first poll. Everybody start voting. Do you provide any orientation to your students with Aquifer cases? So we can see real time about this, getting close. Give it just a couple more seconds, and we're split. Okay. So this looks like this is going to be a great topic. Perfect. So that's what we were hoping. There you can see this is where we ended. So a great topic for us to talk about. So I'm going to close that out. And so here are our panel discussants. And I'm going to let them introduce themselves. I'm going to stop sharing. They're going to unmute and share their video so you can see them talking, and then we will get going. Okay. All right. So Dr. Sood, would you like to start?
Sure. I'm Launika Sood. I'm the Clinical Education Director for Internal Medicine at the Elson S. Floyd College of Medicine at Washington State University in Spokane, Washington. Very excited to be here. My role in the curriculum is an oversight over the 4-year MD program for internal medicine. So me, along with my other colleagues who are clinical education directors and longitudinal directors, work on making sure that our course is integrated throughout the 4 years and then going into GME as well. So I work with directly teaching our students in the pre-clerkship years as an instructor, but my major role is in the 4th year as the sub-I director. So I'm very happy to be here.
Perfect. Dr. Bierman.
Hi, Jennifer Bierman. I am, as Sherilyn said, the co-lead of student engagement at Aquifer, which is really trying to get more student voices to help us improve the product as well. But I spend most of my time at Northwestern in Chicago as the clerkship director of a longitudinal 4-year primary care clerkship, but spend the majority of that time working with the M3 students, which is where we use the Aquifer cases.
Great. And Miss Nabi.
I'm Wafa Nabi. I'm a fourth-year medical student at Case Western Reserve University School of Medicine. I'm also a member of the Aquifer Student Advisory Board. And I've had a whole year's worth of experience with Aquifer as both a student going through the cases throughout my clinical clerkships and on the administrative side as part of the Student Advisory Board. So thank you for having me.
Perfect. So we know that setting expectations and orienting students to cases can help increase their value. Dr. Bierman, can you talk about how you orient the students to the cases?
Yeah, so I unfortunately have to admit that when I first started using Aquifer cases, I really did not orient them. And, you know, I told them it was their homework in a sense, and detailed it in the syllabus, but not verbally very much. So, and there was not a lot of uptake. And of course they were like, okay, are we still going to use these Aquifer cases? And I think it's an amazing product. So I decided I should probably talk about them more. So I do orient the students early in the year. I have all the third-year medical students, and we have an orientation to their third year in the longitudinal clerkship. And I focus with the Aquifer cases, having them think about where did these come from? So really go through the history of Aquifer, that they were created by clerkship directors based on the national curriculum. And that students who do multiple cases do better on their STEP exams, the Aquifer exams, and along the way, they're getting a lot of very good clinical knowledge embedded within the cases. And yes, the cases are long, but so is seeing a patient. So I always talk to them, it's not about doing all the test questions for the exam. This is more about where is your clinical reasoning? Because that's really what's going to help you out as an intern and a resident, is how do you see the patient? How do you order the tests? Maybe you missed something on your differential, but if you know how to order tests, you're going to pick it up along the way. And so I really emphasize that to them, that they should use these within our curriculum. And I have highlighted this with them. I say, look at what our didactic sessions are. Find those cases that we're not necessarily talking about or you haven't seen in your clinic, and to really focus on those. For example, next week I have a smaller group of students, and right now you cannot see a patient with an upper respiratory infection in our clinics. They are in the COVID tent. So colds, allergies, so that the upper respiratory one is a perfect one for them to go through, because they are not going to see it clinically. And Aquifer is probably one of the best stimulated patient experiences that they can have.
Great. That was a wonderful overview, and thank you for being honest that you explained, right? Like what could happen. So Dr. Sood, you have a slightly different approach to orienting, you know, based on your curricular needs. Can you tell me a little bit about that, please?
Absolutely. So our program started using Aquifer, I think at the time that COVID became a pandemic. I don't know if there was some kind of magic going on there, but it really helped us in pivoting our curriculum from a basically a clinical clerkship to one that was virtual. So it allowed us very quickly to adapt our experiences to an online curriculum without really reducing the quality of our education for our third year clerks. So in our longitudinal integrated clerkship, we essentially had 6 weeks worth of immersions that were weekly immersions into each discipline. So the way that we oriented our students was twofold. We started off with our educational IT group, orienting the students and the faculty separately to Aquifer and sort of the logistics around using it as a learning platform. And then additionally, our colleagues who are my partners, my clinical education directors, offer the students an orientation of how they would be specifically using the Aquifer cases to better integrate into the curriculum that allow them to have a deeper dive while also extending their learning. So we'll talk, I think, a little more about how Aquifer helped us integrate our clinical curriculum. So I'll leave that for a second. But that's sort of our overview. I polled all our clinical education directors, and everyone said Aquifer did a pretty good job with orientation. Generally, it was a pretty user-intuitive platform, so they didn't feel that they needed to reorient them further.
Great. And so you mentioned that you did something pretty unique into your curriculum. So you want to, I know your program you just outlined, like your program, Dr. Sood, did a whole bunch of things. And going all virtual. Can you give us a quick overview of some of like those integration examples that that you innovated with? That would be great. Thanks.
Yeah, so absolutely. So I will beg, borrow, steal from what my colleagues did, because most of what they did is phenomenal. So I'll give a couple of examples from the different disciplines. So in pediatrics, my colleague Chris Anderson used the Aquifer cases as templates so that the students would practice other clinical skills like giving an oral presentation, consultation, transitions of care, prescription writing. In family medicine, my colleague Jeff Haney did a deeper dive into structural barriers to the care of patients in the outpatient setting, as well as figuring out the social determinants of health. In psychiatry, my colleague Matt Layden used the Aquifer cases as scripts for standardized patients. So our students virtually had an opportunity to interview those patients or standardized patients. And then in internal medicine, I had the students follow 2 Aquifer patients throughout the entire week. And every day I would add a new thing that happened to that inpatient. So for example, the patient that we had presenting with chest pain suddenly became hypotensive on day 2, and the student needed to figure out how they would recognize and approach the care to that patient. So all of us agreed that none of us had to go from, get down, from ground zero and start building cases, because it was a very, very strong repository that was available at Aquifer. We've used it in radiology and in some of our 4th-year courses as well, very successfully.
Great. And so speaking of 4th-year courses, I know Dr. Bierman, you also did some pretty unique things during the COVID time, engaging your 4th-year students. You wanna talk about that a little bit?
When COVID started, I actually had, I have a longitudinal clerkship, but the 3rd year spent 2 weeks with me. So we had a group of students who were doing intensive outpatient, and they could no longer be there. So we had them, and then I also had some 4th-year students who needed to get their teaching selective requirements done before they could graduate, and where they taught in the CEC went away. So I had the 4th-year students pick a case, and they did a lot of the medicine cases, the geriatrics cases, the high value care cases. They had the M3 students, which was a group of about 12, read both. They did the cases independently, and then the 4th year took cases from the wards from the past year or their clinics and sort of did cases that were similar and really pointed out what things were important in Aquifer, or what extra things they learned when they did it this way. And it was on Zoom. It was completely engaging. The 3rd year students were so appreciative of the 4th years, giving them tips, and it really made it real to them. They're like, oh, these are really important. So it's sort of a win-win on both ends of that. And it's something that we're going to continue to do even as we're starting to see patients again as well, because it was very well received by the students and they learned a lot.
That's awesome. Thank you. And both of you, thank you for highlighting those innovations and the way that you orient students. But the real thing is now we get to hear from Ms. Nabi from the student perspective about, what's really, that's really where the rubber hits the road, right? What's meaningful for students. And so, you've had a lot of experience with the cases. You outlined that so really well. So what would be your advice for faculty when we're thinking about how to orient students? What would be useful?
So first of all, I would recommend that faculty start off by encouraging students to complete the cases. They really are the closest virtual learning experience to actually being in clinic. I would encourage educators to tell students about all aspects of the Aquifer cases and encourage them to make use of them, like the deep dives, the questions, the downloadable case summaries that can be used for review throughout the entire year for both clinical performance and for shelf exams. I would also recommend that faculty encourage students that actively engage with the material presented on Aquifer. For instance, they can make their own flashcards based on that material. I would discourage educators from assigning the cases in bulk or assigning deadlines for completion of the cases. One of the most beloved aspects of Aquifer, in my opinion, is the flexibility it offers by allowing students to learn on their own time. So mandating the cases would only make a stressful training experience even more stressful because, and also of less yield to students because they feel like they have to often rush through the cases to submit by a certain deadline, as opposed to taking their time with each case and going through all the aspects of the case and really squeezing out all the utility from each case that they can if they did it on their own time. For this reason, I would recommend that educators encourage or assign a doable number of cases, taking into account that each case, as you mentioned, Dr. Smith, takes about half an hour to 45 minutes to complete. And so that students can really take their time with each case and learn from every teaching point, question, and deep dive. And I would also discourage the use of Aquifer for evaluating students. Aquifer is meant and has been developed mainly as a learning resource for students. So allowing them the space to make mistakes and learn from them without the added pressure of being assessed or punished for these mistakes is how students can gain the most from Aquifer. And lastly, I would recommend that educators recommend specific cases for certain rotations. For instance, throughout my third year, I had obstetric-related cases assigned for obstetric rotations so that students can complete these on their own time. To allow for maximum retention and clinical correlation, the cases are most effective when they are connected to the curriculum. So tying them to specific and relevant clinical experiences is how I personally gained the most out of Aquifer for both my shelf exam performance and my performance on the wards.
That's wonderful. Thank you. So now, as we wrap up this part of the panel, I'm going to loop back around to each one of you so you have a second to think about this. And so, you know, what pearl or secret would you like to give the people on the webinar as your big takeaway? So coming back to Dr. Bierman, you started us off. Can you give us a pearl or a secret, something to take away?
My pearl would be to get them to do it early in the course, because then they know the value of them. So maybe not say you have to have one done, but highly encourage one of them early. And that really definitely helps. And I have the advantage that I see students just after they've taken, traditionally after they've taken their step, after they've studied, they're going to start all their clerkships. And so I say it does help on the wards, it helps in the clinic. And so just pick one and do it. And that really has allowed the students to see the value of it over time and use it throughout their third year.
Perfect. Dr. Sood.
Yeah, I think I strongly believe that within a course and across courses, it's very possible to offer differing ranges of integration with Aquifer into as they align with your learning objectives. And it's also helpful to consider that you can make them level appropriate for years 1 through 4, even beyond potentially. I think there was a chat question around that.
Perfect. And Ms. Nabi, you gave some great advice. What's your one pearl for us to remember forever?
My one pearl would be to make sure when integrating the cases to always keep in mind what makes Aquifer so special as a learning resource. First of all, it's accessible and flexible, so allow students to take them at their own pace. They're extremely thorough and break down every aspect of the clinical encounter. So I would definitely encourage students to take advantage of all aspects of the case and not rush through the cases. And they're highly clinically relevant, so I would integrate the cases throughout the clinical curriculum as they become relevant throughout training to maximize student learning.
Perfect. So thank you all. And so what we're going to do now, there's more to come. So sharing my screen again, and we're ready for another poll as we move to the second part of this webinar. So Rose, if you can put up the poll again, that would be great. And so this question is, do you provide any orientation for your faculty or preceptors to the Aquifer cases? We'll be interested to see what this looks like. If you're not sure, it's okay to say, I don't know. And I have a suspicion that this is going to be different than the student one. So here's what we got. It does look different than the poll for the students. So most faculty members don't get oriented to the Aquifer cases. So this is not surprising to me as well. Thank you for voting. I'm gonna decrease that. And then, so what I'd like to do is to introduce our next two panelists a little bit, Dr. Bowman and Dr. Draus. And so what I'm going to do is stop my share. They are ready to talk. And so I'm going to let them introduce themselves. So I'm going to start with Dr. Bowman. So.
Hello, everyone. I'm Jamie Bowman. I'm a family physician and the director of the Longitudinal Integrated Clerkship at Washington State University's Elson S. Floyd College of Medicine. In that role, I get to oversee the entirety of our third-year curriculum, which is formatted to be a community-based longitudinal integrated clerkship. It's for all of our students, so we're all in with that learning. It's also community-based and housed across the entire state of Washington. So thanks for having me. I'm happy to be here.
This is awesome. We didn't do this on purpose, but it's cool that we have LIC Day today. So that's great. So Dr. Draus, would you like to introduce yourself and talk a little bit about who you are and who you work with?
Sure. So hi, everybody, and thanks for having me. I'm glad to be here. I'm Joanna Draus. I am also a family physician. I am based at Florida Atlantic University at the Charles E. Schmidt College of Medicine in Boca Raton, Florida. So, Palm Beach County is seeing a lot of COVID right now. But my roles at the university, I'm the Associate Dean for Faculty Affairs, as well as I'm the Clerkship Director for what we call Community and Preventive Medicine. It's our longitudinal family medicine clerkship. So we use an LIC model for all of third year. We're also community-based and have our students in our partner hospitals. And my responsibility is placing our students with longitudinal primary care preceptors for the length of the year. So I have 64 students that are with me for the whole year with their preceptors for the whole year. And I'm happy to chat about how we encourage them to use Aquifer.
Well, that's great. So that's a perfect, and so we'll start with you, Dr. Draus. So tell me a little bit about how you work with those preceptors. It's a great model. They're community-based, so that's maybe a little bit different than academic-based. So tell me how you orient them to Aquifer and your curriculum together.
Yeah, so, I really think that this is all part of the relationship that I've built with these preceptors over the year. And I always hear people speak about the fact that there's a preceptor shortage, that it's difficult to recruit preceptors, that they get burned out. I will say that, the LIC model is a great way to engage preceptors without overwhelming them, because they'll have their one student for a half day for the entire year. That's not overwhelming in a busy practice. And so over the years, I've really worked to develop a relationship with these preceptors where they can expect visits from me multiple times over the year. And I do visit all of them in their office. I don't expect them to come to campus, when they're busy and it's geographically not always convenient. So I'm a bit of a road warrior, driving around and visiting our preceptors and students while they're in the office. So the bulk of the orienting happens before the start of the third year, before the student arrives, when I will book 15 minutes with each preceptor to actually sit down with them and go over, just remind them what the objectives are, if anything's changed for the year. And at that time, I'll always go over the schedule for what the students are covering in their academic half day with us, as well as what they're going to see in the Aquifer cases. And I feel like it's very important to engage our preceptors so that they know temporally what the students are working on at a particular time, and actually encourage them to say, hey, if you know that your student is learning about whatever it is and case comes into your clinic, engage the student. And, and it's okay to even say to the student, what did you learn, through your case or in your academic half day with the faculty at the medical school, what can you teach me? And so our preceptors are really open. I find that, they'll prompt me, they'll ask me for the schedule of, what the students are going to be covering. And so they know, that this is a part of our curriculum, and that we give them the flexibility as well as the student to sort of mesh these things together at the time where it makes sense based on what's happening in their clinical practice.
Great. And do you have the educators actually go into the cases when you're just a little nuts and bolts? Do they go into the cases? How do you orient them to like what's an aquifer?
So they're not, they are in private practice, and, our university faculty will actually go into the cases. So those of us that do academic half day and spend time with the students sort of on campus in small group case learning, we changed our academic half day from lectures to these sort of, we call them diagnostic rounds, and they're meant to imitate clinical rounds. And so we do a lot of case-based work. So our core faculty that are on the campus are the ones that are expected to sort of use the cases with the students. Our community faculty, it's more, here's the topic, you can integrate it into what's happening with your patients.
Perfect. And the reason that I ask you is so that everybody on the webinar knows, like, it's okay to have different expectations for different people depending on what their roles are and how busy they are. So, we heard from your colleague, Dr. Sood, Dr. Bauman, that you all did a lot of quick changes and experimentation. Can you tell me a little bit about the small group assignments that you built around the Aquifer cases, and how do you support faculty in doing that?
Absolutely. So yes, Dr. Sood oriented you a bit to how we initially began using Aquifer. Really is a substitute for missed patient care experiences as a result of the pandemic. It started in Washington, so we had to suspend our clinical learning about the beginning of March. And we decided that probably the best format to continue relationship building, which is one of the central components to a longitudinal type of curriculum, it was to create some small groups that would meet online and be facilitated by community physicians. So we actually put 2 of our 4 campuses together in one large group, the other 2 in the other large group, and then divided them out into very small groups of 5 students each. So each of the small groups were really rather intimate and tiny, and we paired that with a community physician whose scope of work would cover that discipline for that week. I got to participate in OBGYN because I'm a full scope family physician, so I could do everything except for the pelvic surgery. And in general surgery areas, we paired up some of our facilitator preceptors so they could actually bounce ideas off of each other and learn from each other as well. We took kind of a 3-pronged approach to support those faculty. we oriented them first with a written guide, and that written guide was developed in order to face both the students as well as our faculty transparently, so everybody knew which cases were assigned for that week, what were the actual learning goals for each of the cases, and then how were those learning goals planned to be assessed. Because of the format that we had, most of our assessment tools could be directly observed deliverables in a presentation or a discussion format, which made it really nimble and really quick. The second thing that we did for our community physicians who were facilitating is we gave them at least 3 days to read and digest that case that they were covering as thoroughly as they possibly could. Using Ms. Nobby's feedback, we also kept the number of cases per week limited to about 4 cases per week. Some of the disciplines had a little more, some had a little less, depending on how we used it. Then the third thing that we did that really was incredibly important for our community physicians to feel a sense of ownership over the work and to lend their level of expertise is we gave them permission to modify the case. So start with the case as it was written, but then ask the patient either an evolution of their disease, or we were meeting the goal of some of our clinical skills development. We gave our community faculty permission to shift pieces based on their experience. So for example, in one scenario, we chose a relatively straightforward discussion of contraceptive options for a multigravida 30-year-old patient. And we gave our community physicians permission to change that patient's age and compare and contrast. How would it be different if that patient was young and not yet decisional about her reproductive rights? What would happen if her social determinants of health changed and there was an access issue or a cost issue? What would happen if there was a past medical history component that added a layer of complication? Not only did that let our community physicians use their authentic experiences to inform the case, but it also helped us more appropriately level set on the fly for what it is that our students knew, because they were at the end of their LIC experience.
That's really great. Thank you, Dr. Bauman. Dr. Joster, tell us a little bit about your academic day, because this is a great way to compare and contrast. How do you support your faculty in that? It's a little different than your preceptors.
Yes, so when we assign students to preceptors, they know that academic half day is never on the table. And, even if something's going on with one of their continuity patients, that the students will always be with us. And so we use our core group of sort of in-house, either clerkship directors or core faculty. We set up the curriculum in advance in terms of the topics that we wanted to address, really minimizing the number of lectures and focusing more on these sort of clinical rounds. And we developed a template that sort of outlined how we wanted the students to approach the topics. And we give them an hour independently in small groups together. We used to do this on campus where, the students would go into one of our sort of breakout rooms for PBL. They'd work together, research everything that was outlined in the template. And then an hour in, the faculty member would come in to sort of discuss through everything that they had found and really sort of firm up what the plan was going to be in terms of addressing the patient, and ask some of those sort of nuanced questions about covering the learning objectives. And so with COVID and not being able to meet in person, we transitioned these online. And what we found is that the same format works well. I think initially for the students it was that sort of like figuring out how to work as a group online, and the groups stay the same for the entire academic year because it's based on where they're stationed for the LIC. And it's really the facilitators that rotate. And so for us, it was sort of that we set up these templates in advance. We could tweak them, based on how the sessions went with the group. And we were constantly evaluating over the year feedback from students on what was, helpful, what else, what would they like more of. And, by the time we got to online, we were sort of a well-oiled machine, to give every student the opportunity to work through every case. And so we're continuing that this year online with our students.
That's awesome. And so as we, begin to wrap up this session, and you guys have given some great examples of integrating and the scaffolding that's needed for, your curriculum. Dr. Bauman, what would be your one pearl that you would give for, faculty, orienting the faculty to Aquifer and your curriculum?
It's kind of a bit of a double pearl. One is that I like giving the faculty the access to the cases so they really had a thorough understanding of what the case was attempting to teach and how that information was going to be assessed. But I think our greatest piece of excitement came from giving them some creative license to use the case as a springboard for further discussion. Really facilitating those conversations and discussions with students was a huge wealth of learning for their critical thinking.
Perfect. Dr. Draus.
So I would share, that doing an orientation in real time is, sort of important as the students are arriving, and really sort of giving preceptors permission and encouraging them to match what's happening each session that the student is with them in the clinic with what we cover sort of as part of our core curriculum at the college over the course of the year. So letting the preceptor be the one and in encouraging them to figure out how to blend the two together. So, the preceptor's aware, these are the topics, these are the things that we're going to cover with the students, and then they can sort of pull the student back to what's happening in the clinic and say, go and watch this case again, come back tomorrow, tell me what you learned, kind of thing, and, discuss it with them based on what's happening with their patients.
Wonderful. Well, thank you both. This was really great. I'm going to share my screen and just wrap us up for the very last couple of minutes. Thank you all for just great conversation, great insights. I hope that others learned as much as I did for this session. So just a couple of logistics. We will be following up with an email. We have a little survey to see if how you all felt about the utility of this webinar, and we will provide links for this session. All of the recordings, like I showed you at the very beginning, are also available on our website. A couple of reminders. So I'm sort of doing this is what we're going to teach you, this is what we taught you, and here's what we taught you. Here's, take the orientation course. I think it's a good use of time. Have the course directors review the educator guides and resources, and link to the webpage that we have for students. And remember the great pearls that these wonderful educators gave to us. And I'm going to include our wonderful student. She's educated us as well. So thank you all for that. Our resources for you, I showed you them on the website. So some practical things, get starting videos, our blog, the webinar series. And for students, these are mobile apps, and there's that student learning resources in Aqueduct itself. If after all of this, you're like, oh my gosh, I went to that webinar and I still don't know what to do, the people here are ready to help. So we have two great relationship managers, Kate Hancock, who helps all of our allopathic medical schools, and her email address is right there. Leah Romano helps our osteopathic, physician assistant, nursing, residency, and international programs, and her email is there. Please reach out to them. They are great resources, wonderful for information. They hear so many stories around the country, and so they're great tips, and they can help you connect in the way that you need to. We also, as I mentioned, have peer consultations with educators. I showed you the place on the website. There's the direct address. Just click, you can schedule an appointment, and we'll be happy to talk to you. No question is too small, and we arrange this to meet your schedule, and you'll be talking to another educator from around the country. I showed you our consortium. There are many of them who are willing to help. Final reminder, we do have a couple more webinars coming up. So about our surgery and residency prep courses through NYU, as well as remediation at the end of August. And finally, just thank you so much for being here. Really appreciate the time. And I hope this was useful for you. And please have a great rest of your day. Thanks very much.
Thank you, everyone.